This is our presentation on diabetic emergency. Diabetes, know the symptoms. Are you always tired, frequently urinating, have sudden weight loss, wounds that just won't heal, sexual problems, always hungry, blurry vision, numbness or tingling in the hands or feet, always thirsty, or vaginal infections? About diabetes. Type 1 occurs in 5% of diabetics. It is usually diagnosed during childhood. This is where the body does not produce insulin properly. The most common form is type 2. It may be controlled by diet and exercise. This is where the body doesn't use insulin properly. Some risk factors of diabetes include weight, fat distribution, inactivity, family history, race, and age.
Hyperglycemia is when you have high blood sugar. If left untreated, it can become severe and lead to serious complications requiring emergency care, such as a diabetic coma. In the long term, persistent hyperglycemia, even if not severe, can lead to complications affecting your eyes, kidneys, nerves, and heart. On the left, you'll see some general signs and symptoms of hyperglycemia. On the right, you'll see a list of immediate signs that, if seen in your clinic, would require immediate intervention.
Here's an example of how to test blood sugar using a glucometer. First, make sure that the lancing device, which pricks your finger, is loaded with a fresh, sterile lancet. Adjust the depth at which the lancing device will prick, if necessary. Insert a fresh testing strip into the glucometer. Make sure that the code for the testing strip matches the code that displays on the glucometer. Place the lancing device against the side of your finger and gently depress the button to cause a finger prick. Hold your finger below the point of lancing and squeeze your finger to help a small drop of blood emerge from the lancing site. Hold the finger up to the testing strip and allow the drop of blood to flow from your finger to the testing strip. Wait a few moments while the glucometer analyzes and displays your sugar.
Once your patient has tested their blood sugar and they see that they have high blood sugar, they will need fluid replacement, electrolyte replacement, and insulin. This is a picture of different types of insulin pens.
Hypoglycemia is when the blood sugar is too low. Many people, even those without diabetes, experience hypoglycemia. You may or may not have any symptoms. If you do experience symptoms, common signs are shakiness, sweating, racing heart, dizziness, anxiety, and hunger. If left untreated, hypoglycemia may lead to seizure or unconsciousness. The standard treatment for hypoglycemia is consuming 15 grams of simple carbohydrates. So, if a diabetic patient has a blood sugar reading below 70, it's snack time. 15 grams of carbs can come in many forms, like glucose tablets or gel, half a cup of juice or pop, 8 ounces of 1% milk, a tablespoon of sugar, honey, or corn syrup, or sugary candy, just to name a few. Wait 15 minutes and recheck the blood sugar. If it's still low, repeat the whole process.
Here are a few pieces of equipment that your patient may have. On the left is a picture of an insulin pump. Your type 1 diabetic patient may have an insulin pump. If your patient wears a pump and experiences a low blood sugar, he or she will need to turn off the pump while recovering from the low blood sugar. On the right is a picture of a glucagon pen. Glucagon pens are used to rescue a patient from an extremely low blood sugar. Your patient or a family member should use this pen if necessary, or in the event of an emergency, you may be advised to use the pen by 911.
As we said, if hypoglycemia or hyperglycemia is left untreated, the patient can lose unconsciousness. If a patient you are treating passes out, note the time and call 911. They will instruct you on what to do. If a family member is present and knows what to do, let them respond. Of course, be sure to document what happened in your daily note and contact the physician before the next treatment.
Thanks for listening.